Okay, hello everyone. Greetings and salam. Welcome to the first session of International Short Course on Nursing Informatics. Thanks for joining TUMS. This program is a short course by the Department of Medical Surgical Nursing and the Vice Dean of International Affairs of School of Nursing and Midwifery, Tehran University of Medical Sciences. It's our honor to have you all here with us. As it is noticed, the course will be held in 4 sessions, and today is the first session on 20 February. Next Saturday is the second session, 27 February, and March 6 and 15. And the time is 15:30 to 17:30 GMT, which is 7 to 9 p.m. in Tehran time. So good morning, good evening, good afternoon, good night, and good day to all your all audience from different countries. The director of this program is Dr. Khater Seilani, our Vice Dean of International Affairs, and our Assistant Professor. Moderator is me, Dr. Asiye Darwish, a lecturer and head of IT courses at the faculty. Special thanks to 3 outstanding pioneers with brilliant nursing informatics experiences from US. Thanks for accepting our invitation, and we look forward to their valuable lectures. Professor Tony Hebda, Professor Caroline Sipes, and Dr. Melody Rose, who, in addition to their academic teaching experience, are the author of valuable nursing informatics books and articles and papers. We are so honored to have you as our lecturers. In addition, my honor to be one of the lecturers of this event from Iran, and Dr. Tanya Azadi is the other Iranian lecturer who is a health informationist, both with experience of scientific activities and the publication of related books and articles. Okay, dear participants, please notice that you all are on mute. If you have any question throughout the lecture, please write them in the chat section located in the below right panel. Our colleagues will try to help your technical issues, and your nursing informatics questions will be answered at the end. Another point is all the sessions will be recorded, and the recorded version will be available at TUMS website. Special thanks to my friends from Health Information Management System Society and International Society for Telemedicine and eHealth, and Nursing Informatics and Nursing Communities who shared our event info. And thanks to pioneers, teachers, lecturers of different countries which are experts in nursing informatics and joined us in this course. Today's session will last 2 hours with a 10-minute break in between. First, I would like to ask Dr. Seilani, the International Vice Dean of the faculty, to speak for 5 minutes. Then I invite our special guest, Professor Hebda, to speak for 5 minutes, just a brief introduction and her interest, the history of her interest in NI. And after that, we will have lecture of Dr. Azadi, our first lecturer of this session. Please, Dr. Seilani, would you please start? Are you ready? Okay. Thank you. We hear you. Please start.
Hello. Hello, Dr. Davish. Can you hear me?
Yes, of course. We hear you. Please start. Thank you.
Thank you very much. Ladies and gentlemen, hello and welcome to our online short course on nursing informatics. It is our great pleasure to have you all here. I'm Khatere Seilani, the Vice Dean for International Affairs in School of Nursing and Midwifery, Tehran University of Medical Sciences. As you know, TUMS is the first-ranked university in Iran and a prestigious university in the region. Our school is the scientific hub for nursing in Iran, and as a pioneer school in nursing and midwifery, is committed to pursue and establish new majors in the field of nursing and midwifery to provide colleagues with the updated and latest achievements and knowledge and skills for modern nursing. One of the areas that should be improved in the curriculum of nursing in Iran is information technology. And I think this is a vital need, not only for our curriculum, but also for the whole region and our neighbor countries to improve their nurses and knowledge and skills in the field of information technology. In this regards, we are going to establish nursing informatics as a major in MSc level and postgraduate studies. And as the first step, fortunately, we get familiar and we connect to, and then we could enjoy collaboration of a very distinguished team of experts in nursing informatics from USA with our own colleagues in this field. This is a brilliant beginning, in my opinion, that will extend and will be developed to an online nursing informatics degree-based program. You know, Corona pandemic was a bitter experience, but on the other side of the coin, it encountered us with some neglected aspects in our field of study and field of services, and revealed that how IT-based nursing services are essential and important in screening, education, and follow-up services in this pandemic. Now, I would like to let you enjoy the first session of this short course, that covers a vital need in our career, with the lecture of our great lecturer, Dr. Tanya Azadi. And I think this is a change in the program. I think I should invite you to listen to the interesting introduction of nursing informatics with Professor Tony Hebda. Am I right? Thank you for your attention.
Yes, thank you so much.
You're welcome.
Thank you to Dr. Seilani, and thank you, Dr. Darvish. I look forward to these series of webinars. I am very excited by all things nursing informatics. I think from what I have read of the literature and the research that's been going on in your country, as well as in many other regions of the world, that we are doing much to catch up. And yes, COVID was a very sad thing for everyone, but there are positives for us to take away, particularly with data sharing and telehealth and many other facets. So I will, at this point in time, primarily step aside to hear our first lecture, I will just say that I've been interested in nursing informatics from before I was aware of what the term was. So I always look forward to every opportunity to talk about nursing informatics further. I am one of the many nurses who did not start with a formal education in nursing informatics because we didn't have the programs in place yet. So I'm even more excited to see those programs taking off. And I'm just thrilled that I have the opportunity to teach nursing informatics in the United States as well. So on that note, I would like to turn this over to Dr. Asadi and get to the meat. Thank you.
Thank you
Thank
so
you,
much.
Professor Hepta. So, hello everyone, and once more, welcome to the online short course on fundamentals of nursing informatics. I'm Tanya Azadi, and we're going to focus on principles of nursing informatics today. But before we actually start the lecture, I'm going to ask our dear host to just start the quick self-assessment. So just 5 questions, and I want that everybody just read the questions and answer them. We're going to do this quick assessment before the presentation and once more after the presentation. So our host, if it's ready, I would appreciate it if you could launch it so everybody can see and have access. So I think it's going to take a little bit time. Our host, Zohra, is just a fabulous colleague of mine. I would appreciate if she could launch the poll so everybody can see it on their screen. It includes 5 questions. And once it's on the screen, you can just answer 5 questions. So I would appreciate if it's ready. Would you please just launch it?
Yes, I will ask them. Please wait for 1 minute.
There you go. We can see the poll. So here we have 5 questions regarding the principles of nursing informatics. Please read the questions and answer the right choice. We're going to have 5 minutes here. And after that, we're going to just end the poll. So these are just sample questions that we're going to talk about during the lecture today. So I believe we're going to spend 1 more minute or perhaps 2 more minutes so everybody can have a look at the questions. I would appreciate if everybody inside their answer to the poll. So I guess we can now end the polling. I would appreciate if our host just remove it so we can start the lecture. Ms. Sadeghi, I would appreciate if you just could close the polling so we can start the lecture. Thanks for everyone who participated in the polling, and polling is over now, and in some minutes we're going to start. Okay. So, education management, I have educational background, which is my BSc and MSc in medical information sciences. I've been lecturer of health informatics, health information resource management, and information systems for graduate and undergraduate students. And I had contribution to the translation of different major textbooks into Persian, particularly in the field of healthcare information systems and project management for healthcare information technology. So here's a link to my Google Scholar page. If you're interested, you can visit to get to know my works. So at the end of this course, actually at the end of this session, you're expected to define informatics and nursing informatics, explain the historical context of nursing informatics, discuss the knowledge hierarchy, which is data information, knowledge, and wisdom, discuss the importance of developing nursing informatics skills, identify the relationship of nursing informatics with other informatics and biomedicine as the core science, discuss some of the applications of nursing informatics, particularly in practice, research, education, and administration. You would also be able to identify nursing informatics specialist roles, particularly from the perspective of some associations such as ANA. And then for the closing discussion, we're going to discuss about some nursing, some challenges that nursing and also other health
Okay, sorry, just only 2 minutes. There is an internet problem, and she will come back soon. Please wait. Thank you.
Oh, sorry. I guess I had I had lost my connection. So Dr. Darvish, I would appreciate if you say until which slide actually did you have me? And I'm going to turn off my video because I guess it will help.
Just only the last one you were talking about, it was corrected. Only 1 second.
Okay, so you had me all?
Yes, slide 4. From slide 4, please continue.
Okay.
Thank you.
So can you see the slides now? I guess you can see that.
Yes, of course, we can see. Please continue. Thank you.
Thank you, and sorry for any inconvenience. So, and I was just saying that the informatics is the integration of the two science of computer science and information science, and it's not usually used alone. It's used with in conjunction with another discipline, which indicates the application of computer science and information science to the management and processing of data, information, knowledge in that specific discipline. So we can assume that we have different informatics in biomedical sciences, such as health informatics, clinical informatics, medical informatics, nursing informatics, and even veterinary informatics. Having said that, what is nursing informatics? So based on that definition, it's the management and processing of nursing data, nursing information, and nursing knowledge using technology, and by technology, we particularly mean by computers. So it's going to support the nursing practice, nursing research, nursing education, and nursing administration. And basically, it's the process of data collection and acquiring that healthcare data for improving patients' outcome. Let's discuss a little bit about the historical context. Well, informatics and the adoption of technology is not something new for nurses. Actually, nurses have been using and utilizing the technology maybe at least at the time of Florence Nightingale in the United States, and even earlier at the time of Jean Manck in Canada in 1642. As an example, Florence Nightingale had a vision of having a standardized clinical record, which enables her to use that data for comparison and for assessing, and ultimately using that clinical documentation for improving the healthcare of the patients. But if we want to formally just distinguish some points in time regarding the history of nursing informatics advancement, maybe we can put it into 5 categories. Started with 1950s, where then healthcare began to use computers, particularly for administration and management of financial matters in the hospitals. Then in 1970s, nursing profession became involved in system development in different phases of a system development life cycle, such as designing, purchasing that information system, implementation, training, and also evaluation that information system. Then in 1980s, we can see that nursing informatics has emerged as a specialty, and we can see that different colleges, different universities, little by little, are going to provide nursing informatics programs. And also, it's in 1980s when we can see that there is an exponential growth in the application of personal computers or PCs, and the application of hospital information systems and management information system in hospitals and healthcare settings. Then in 1990s, then we can see another huge thing as telemedicine that has emerged as a specialty and actually has impacted on, let's say, almost every types of healthcare services, which is going to be provided by a hospital. And also, it's in 1990s that we can see the first nursing informatics certification exam was also administered. Then after 2000, we can see that the advancement in information and communication technologies has been really make it sophisticated to have different types of information systems. For example, we can see that computer hardwares or softwares, different types of databases, clinical decision support systems, intelligence systems using artificial intelligence has been emerged. And it's almost after 2000 that we can see professional organizations has been developed, and more innovations, more initiatives has been emerged to kind of foster and the development of nursing informatics as a field. So here I want to provide you with some formal definitions provided by different scholars and different organizations about nursing informatics. But before that, let's take a look at some pictures to see how the healthcare environment has been changed due to advances in machinery and automation. So from now on, we're going to see a couple of pictures. On the left, you can see an old picture belonging to perhaps 1900 or something like that. And on the right, you're going to see the present, actually technology provided at the present time. So it's a light therapy, and we can see the light therapy today, and you can see that the advancement and the level of complication provided by those services. On another picture, as a nurse taking an X-ray in Isfahan, perhaps in 1900, and taking X-ray pictures today. So the level of automation happening in providing every particular healthcare services, such as obvious in the pictures, and you can see that. Or another example would be an operating room. You can see on the left a hospital in New York in 1900. So it seems quite simple, but not much, automation or computer systems or measuring devices connected at the bedside. But on the right, you can see the opposite, that how much automation has changed the services which is going to be provided, for instance, in an operating room. And this advancement is just not happening in providing clinical services, but also in clinical documentation. So it's a prescription from the late 1800s. So it's just handwritten and in a paper-based format. And on the right, you can see that now we use actually computerized physician order entry today for using, for documenting the instruction provided for a single patient. So different types of information through structurized format and unstructured format can be documented. And for instance, CPOE. Or on the left, in this picture, you can see part of an old 19th century medical record and a medical record today. And you can see that different types of information, whether it's an image or it's a text, was provided, and clinical notes, lab reports, medical images, medications, through structurized and unstructurized format could be actually documented in an electronic health record or an electronic medical record. So what I'm trying to say that here is that you can see how much actually automation and advancement, particularly information and communication technologies, have affected the healthcare, in particular the nursing. So nursing has evolved significantly over the past few decades, and we can say that many of these changes has been happened because of those advancements in information and communication technology. And that's all about the sense of informatics in nursing. Having said that, let's take a look at formal definitions provided by nursing informatics, maybe from 1985. To present today, we're going to compare these definitions provided by different scholars and organizations. And at the end, we're going to actually sum up the definition and see how nursing informatics definition has evolved during a few decades. So maybe one of the first definitions was provided by Hannah and colleagues in 1985 when they defined it, nursing informatics, as the application of information technologies in relation to those activities performed by nurses. And so the focus here is on using those information technology to actually performing nursing activities. Another definition is provided by Grove in 1988, and he defined it as the application of principles of information science to study, analyze, and manage the nursing information with the ultimate goal of adding to the body of knowledge in nursing. So you can see that here in this definition, the focus is on application of information science with the goal of adding, establishing a body of knowledge in nursing. Then in 1989, Graves and Karkaran, if I'm not misspelling, actually the names, mispronouncing. They defined it as the combination of 3 sciences of computer science, information science, and nursing science. So this integration is going to assist the management and process of nursing data, nursing information, and nursing knowledge to support the clinical practice of nurses while they're doing the job. So from now on, we can see that the emphasis is going to be on the integration of different sciences, such as information science and computer science, as well as the nursing. And we can see that some elements of the knowledge hierarchy, like here, data, information, and knowledge has been added to the definition. And then in 1994, the American Nurses Association, or ANA, provided a definition for nursing informatics and defined it as the specialty in nursing, which actually integrates those 3 sciences of nursing, computer, and information science to identify, collect, and manage the data and information with the goal of supporting nursing practice, nursing administration, nursing education, and nursing research, and also adding to the body of knowledge in nursing. So in ANA definition, from that knowledge hierarchy, we can see that only 2 elements is added, which is data and information. But ANA later, almost 7 years later, redefined nursing informatics and tried to provide a more comprehensive. And also in 2008, again, ANA redefined nursing informatics, and we're going to see that. While other definitions from nursing informatics was provided by different scholars, such as Tony Hebdar, Wagenhag, and Gunther. And in their definitions, the emphasis was on the application of technology to support different aspects of nursing practice or nursing profession, which is not only the clinical practice, but also education, research, and administration. So in 2001, almost 7 years after the first definition provided by ANA redefined it as a specialty, but then that integrates that 3 sciences of nursing, computer, and information science to manage and communicate data, knowledge in nursing practice. So in the previous definition, the focus was from that knowledge hierarchy on data and information, and here is on data and knowledge. So information is again missing. And we can see that again, almost 7 years later, they redefined nursing informatics and tried to put all those elements of knowledge hierarchy into the practice to make it more comprehensive. And also it's interesting to note that it was ANA that defined nursing informatics as a specialty for the first time. Then in 2002, Staggers and Thompson actually completed that definition provided by ANA by focusing on 3 elements of that knowledge hierarchy, which is data, information, and knowledge in nursing practice. And they also emphasized on some other aspects in providing the definition, such as defining some stakeholders for nursing informatics, such as the patients and also nurses and other healthcare providers. So it's something which was kind of missed in other definitions provided by other associations or scholars. So the emphasis here is on the stakeholders as well. And with the ultimate goal of improving decision-making and improving patients' care outcome. We also have some other definitions, some general definitions. For instance, here, a definition by McCartney, which emphasized only on the safety of the patients and the quality of care which is going to be provided by the patient. So he defined it as a 21st century science with great potential for improving the quality, safety, and efficiency of healthcare. So it's a much broader definition provided by McCartney. And then Sackett in 2004 defined it as the integration of information science, computer science, nursing science, as well as the cognitive science. So it's something quite interesting that we can see that as we go on, different fields of let's say, specialty has been added to the definition, such as the cognitive science. And then in 2008, the American Nurses Association defined it as a specialty, which integrates those three sciences of nursing and computer and information science. And now we can see that all the elements of a knowledge hierarchy, which is data, information, knowledge, and wisdom, has been added to the definition to make it more comprehensive in terms of, framework which nursing informatics relies on, and that is the knowledge hierarchy. And we're going to discuss about that knowledge hierarchy in some slides later during this presentation as well. So all the components are added to the 2008 definition. And another interesting definition is provided by the International Medical Informatics Association in 2009. And IMIA has a nursing informatics special interest groups, and defined nursing informatics as the science and practice which integrates nursing with information and knowledge, with management of information and communication technologies to promote the health of people, families, and communities worldwide. So we can see that some aspects of global health has also been added to the definition. So it just goes beyond the patients and their families, and it reaches to population even worldwide, and it's something quite interesting. So if we want to actually sum up all definitions that was provided for nursing informatics, we can see that the nursing informatics definition and the roles which has been defined for the nurses rapidly has changed over the years. Maybe the focus at first was more on technology, something that we saw in definitions provided in early 80s, and then transited to information, ultimately ending to a combination of those sciences, such as information science, technology, computer science, nursing, and even cognitive science. And another interesting point about nursing informatics definition change in years is the integration of knowledge hierarchy in the definition, something that we saw in ANA 2008 definition, and also the international multifaceted aspects of nursing informatics definition, which was provided by IMIA and I in 2009. Now let's discuss about this framework. So we saw that nursing informatics actually relies on knowledge hierarchy framework. And so there are some central concepts in this framework, such as data, information, knowledge, and wisdom. Let's see each of these components means actually or described, how they are described. So in knowledge hierarchy, data is defined as some discrete entities. So they're just like raw information. They're not yet interpreted or organized or even structured. So these are just some facts. And then when that data is integrated, is organized, or is structured, or a context has been added to that data, then we have information. And the next level, when the relationship between different pieces of information has been identified, and those information has been synthesized, then we are reaching to knowledge. And in the next level, when that knowledge is used within inside and decisions are made upon that knowledge, we're reaching to wisdom. Ultimately, the transformation of data, information, knowledge, and wisdom actually leads to better decisions, which informs the practice. So this framework, we saw that deals with how data is collected and processed with an aim to improve various decision-making levels in nursing profession. When we talk about data here, we mean quality data, and that quality data has some characteristics, such as data is timely, is valid, is accurate, is comprehensive, and is consistent. And so this hierarchy or knowledge hierarchy is also called the IKW pyramid, or data information knowledge wisdom pyramid. Here you can see a figure which demonstrates the knowledge hierarchy. At the bottom of the figure, you can see data and how data transforms to information, knowledge, and wisdom. If we want to provide some examples in clinical practice, we can say that data are like the individual birth certificates file, including birth date. And then when that data is somehow organized and interpreted, then we have information such as analyzed mother age or race or residence. So these are the data that have been analyzed. And then when we use it actually to make some analysis, further analysis, to do comparison, for instance, comparison to prenatal care or socioeconomic status, or to do benchmarking. So we're going to find the relationship between each of these information we're reaching to knowledge. And when that knowledge is used for decision making, we're acting with wisdom. The instance would be some public health interventions, educational campaigns, or an intervention which is revised now based on prior knowledge. So the nursing informatics is relied on how data is transformed to information knowledge wisdom, ultimately for improving the decision making. Okay, now that we have understood the definition of nursing informatics, as well as the framework which nursing informatics relies on, let's see why actually nurses are required to be equipped with informatics skills. Well, the nature of the medicine and the nature of the healthcare industry is complex. And this complexity is not only because of the nature of the medicine, but also because of the complexity of patient needs. And also we saw that during the years, the nurses' roles has been changed, and so their educational needs and also their research needs. So if we want to make sure that we're going to provide safe, high quality, high-tech healthcare, nurses need to be equipped with informatics skills, because much of the healthcare services today is going to be provided through somehow some examples or some instances of technology. And there is no other way but being literate in let's say computer science or information science in order to be able to provide that high quality healthcare. So research says that nurses spend almost 50% of their time busy gathering and documenting clinical information. So if nurses want to use the most out of that organized and well-managed information, they need to be equipped with informatics skills. And if you think about it, you can see that actually it is the vision that Florence Nightingale had in 1863. So she had a vision of having a standardized clinical record, which enables her to use that clinical documentation for assessing and for improving patient outcomes. So that is why nurses are actually kind of required to be equipped with informatics tools. Also, we shouldn't forget about the role of associations and different organizations that had on the advancement of the field, such as the very influential report of the Institute of Medicine in 2010, which actually urged nurses to achieve higher levels of education. So we can see, I'm not going to discuss particularly about the role of organizations on fostering the development in the field, but we can say that lots of organizations has worked on it to provide competencies and skills for nurses and provide them with kind of models and frameworks to show how nurses should be actually equipped with informatics skills. So nursing informatics actually facilitates communication, allows us articulation of organized information. Ultimately, this leads to more patient trust, more credibility, and ultimately improving nursing outcome and patient's outcome. Okay. At the beginning of my presentation, when I wanted to define the informatics, I brought some examples about other informatics, such as bioinformatics or public health informatics or health informatics. Let's see how nursing informatics actually relates to other informatics. So as we said earlier, informatics is used in conjunction with a discipline, with another discipline, so it's just not used alone, which means the application of computer science and information science to the management and processing of that knowledge hierarchy in that particular discipline. And if we assume the biomedical informatics as the core science, we can assume that we have different types of informatics. Here's a figure provided by Shortcliffe in his 5th edition, if I'm not mistaken, 4th edition book, which really provides this relationship that these informatics have with each other. It's important to say that it's not just an ultimate, let's say, categorization. So many of the definitions of these informatics, actually, we should acknowledge that there's confusion for providing definition. And something I'm going to explain is not just something definite. So it demonstrates the actually perspective of the scholars providing this relationship. So let's start with taking a look at this figure at the top of the figure. And I want to start with the definition of biomedical informatics as a core science. So biomedical informatics, which you can see at the top of the figure, is by its nature an experimental science, which means it faces by posing new questions, designing those experiments, performing analysis, and using that information to design even new experiments. So one goal, as a basic research, you can see as a basic research, one goal is simply to search for new knowledge, and that is why we call it basic research. A second goal would be to use that knowledge for practical ends, which here you can see some examples of that, and we call it applied research. And there is a continuity between these two endeavors, from basic to applied research. Work in biomedical informatics is motivated by the problems identified here in these application areas. Maybe one of these application areas is historically has been recognized as the health, as the actually clinical care, which is then we have it as clinical informatics. So the clinical care includes nursing, medicine, dentistry, veterinary care even. So it's an area of activity that focus on patients' needs. Having said that, we can assume that clinical informatics has some subtopics, such as nursing informatics or dental informatics or dentistry informatics or even veterinary informatics. I want you to note that medical informatics here is not actually a synonym for clinical informatics. Rather, it has an application area of clinical informatics, which has its focus on disease and the role of patients. So formerly, medical informatics was used to kind of to refer to the discipline as a whole, but now it's not used to refer to the discipline as a whole. And the clinical actual informatics is the whole discipline. So as it's shown in the figure, at the bottom of the figure, there's a spectrum as one moves from left to right across these biomedical informatics, starting with bioinformatics. So in bioinformatics, as you can see in the picture, workers deals with molecular and cellular processes using those informatics tools and methods. At the next level, we have the imaging informatics, sometimes also called structural informatics in some institutions, which has the focus on tissues and organs using informatics methods and tools. And at the next level, we have the clinical informatics, which has some actually sub topics such as those medical informatics and dentistry informatics. And the focus here is on the patients. And at the next level, we have the public health informatics, which has its focus on populations and society on the whole. Here, it's really important to note that some terms may be used interchangeably and used as synonyms, which is not true, and they're not synonyms. An example would be bioinformatics and biomedical informatics. So these are not synonyms. One is applied research, the other is the core science, which is basic research. Or sometimes maybe health informatics, which is the combination and integration of clinical informatics and public health informatics. So it shouldn't be used as a synonym for referring to biomedical informatics. Again, biomedical informatics is a basic research, rather an applied research, which is the focus of health informatics, which is applied research. Another second important thing is that each of these applied areas have kind of fuzzy boundaries, meaning that many informatics methods would just involve more than one of these categories in some of applied informatics. An example would be biomedical imaging, which involves both bioinformatics and imaging informatics. Or another example would be consumer health informatics, which includes elements of both clinical informatics as well as public health informatics. And the same is applicable to nursing informatics, which embraces some elements and some components of both clinical informatics and public health informatics. So we shouldn't forget that still in literature and from different perspectives of different scholars, the exact definition and the exact boundaries are still in confusion. And so nursing informatics could also be defined as a separate, major separate applied research. Okay. So here we're going to discuss about some of the applications of nursing informatics. Perhaps through different definitions that was provided for nursing informatics, you saw that we really focus on some applications, such as the clinical practice, education, research, and administration. So let's see how informatics tools and methods is going to support each of these areas. And let's start with the clinical practice. Sometimes the information systems which are used in clinical practice are called also point of care systems or clinical information systems. And well, the main responsibility is to support the actually clinical care which is going to be provided for patients. So some examples and modules discussed at this point of care systems would be reminders and prompts that during a documentation appears for a physician or for a nurse to make sure that the charting is going to happen comprehensively. For instance, there's some work list which reminds staff of some planned interventions which is going to be provided for particular patients. So it has some advantages we're going to discuss in some minutes later, such as reducing.
Okay, thank you, Dr.
Pardon, Dr. Darvish? So shall I continue? Okay, so I continue the first application, which is the clinical practice, and then we can have a 10 minutes break, but it's better actually for me to conclude this section, which is the clinical practice. So I was saying that one of these modules would be reminders and prompts that prevents some errors regarding the documentation, and it's one of its really good advantages. Another module which is used in point of care systems would be monitoring devices, which actually are bedside devices, sometimes wearable devices, which record vital signs and other health measurements and medical measurements directly from actually that device, that electronic medical record or electronic health record. And it really reduced the clinical documentation, which is going to happen by a nurse and physician, which means that they have more time to actually provide care to patients. Another actually example would be computer-generated nursing care plans. And finally, automatic billing, which provides the necessary supplies or procedures which nurses require to do during the documentation. So if we want to kind of categorize these tools in clinical information systems, we can refer to computerized physician order entry or CPOE, and computer-based patient records. They could be electronic medical records, electronic health records, and personal health records. Also, we have health portals, which enables patients to also play a role in their care. And we also have terminologies like Nursing Interventions Classification System, NIC, or NOC, which is the Nursing Outcome Classification System, which not only has been integrated into those systems to provide a consistent language to be used by a whole spectrum of stakeholders, but also when these are good for when you're doing research. I'm going to explain that a little bit later. So here I'm going to finish my lecture, and thank you for actually listening so far and staying. And we're going to have a 10 minutes break here, and we will continue after 10 minutes. We're going to continue with other applications of nursing informatics in other parts, such as research, education, and also administration.
Okay, thank you so much, Dr. Azadi. And I also ask participants, please, we have 10 minutes break. And after that, please come back and we ask Dr. Azadi to continue her lecture. Thank you so much.
Thank you.
Okay. Okay, hello again. Welcome back to the session of Fundamentals of Nursing Informatics. We are ready to continue with the lecture of Dr. Tanya Azadi. Would you please start, Dr. Azadi? Thank you so much.
Thank you, Dr. Darvish. So I hope everybody enjoyed their break and welcome back to this short course. So we were discussing the nursing informatics skills, nursing informatics applications in different areas such as clinical practice, and we discussed some examples of the actually clinical information systems capabilities. But also let's talk about some of the advantages that the systems, particularly computer-based patient records, whether they are EMR, EHR, or PHR, they could provide. One advantage would be improved access to the medical wards. So it doesn't matter where, as a healthcare personnel, where you are in a hospital. So once data has been entered, it could be accessible from different parts of and different locations. It also decreases the redundancy of data entry. So it's just enough to provide, for instance, allergies and vital signs once, and they would be available from the entire lifetime of that medical record. It also decreases the time which is required to do the clinical documentation, particularly with automation and using monitoring equipments and bedside equipments. Data can be directly actually go from that monitoring equipment into the clinical record. So it means that healthcare personnel and nurses have more time to devote to provide care to patients. It also improves the exchange of health information between different healthcare personnel inside, let's say, hospital or healthcare facility. And if it's from the type of electronic health records, it could also be shared between different healthcare providers from multiple institutions. So it helps us to provide a safer, more timely, effective, and equitable patient-centered care to patients. It's good to actually note that it also facilitates the data collection for research. Gathering those data is doing for improving the clinical decision making and improving patients' outcome, but it has also a secondary purpose, and it will be research. Having access to large data sets provided by those computerized patient records makes us able, or makes us the healthcare system, including physicians and nurses, able to have access to large data sets of clinical data to do research, whether it is retrospective or prospective. So on the whole, it creates a lifetime clinical record facilitated by that information systems. And also, as we discussed earlier, through decision support tools such as alerts and reminders and prompts, the documentation would be improved. It would be more accurate, and many errors would be prohibited. For example, if during the documentation of a patient allergies in the computer system, there's a discrepancy with specific medications, that will be alerted to the physician or to the nurse, which means preventing, for instance, patient medication orders. Another example, or another actually applications of nursing informatics, particularly in the clinical practice, would be clinical practice guidelines, which today are widely available through web-based and web pages of different organizations. Maybe the most referred one is the National Institute of Health, or NIH, which provides a wide range of clinical practice guidelines to manage different types of disease. So nurses can use those clinical practice guidelines to make sure that they are providing the most up-to-date and the most recent care to patients. For instance, NIH provides clinical practice guidelines on a wide variety of diseases such as asthma, cholesterol, hypertension, obesity. We have also other scientific associations which could perform this role, and also private companies and institutions such as Medscape for nurses. Here you can see actually a screenshot of the American Association of Clinical Endocrinology, or AACE, which provides clinical practice guidelines for management of diabetes. Or here a snapshot, you can see a snapshot of Medscape, which provides a wide range of clinical practice guidelines for a wide range of disease such as allergy and clinical immunology, anesthesiology, cardiology, critical care, dental and oral health, and etc. So these are happening because of using the informatics methods and different databases behind the scene, which provides this type of information available for nurses. So another or a second application of informatics would be in nursing administration, which is generally referred to as healthcare information systems. So there's a slight difference between a healthcare information system and a clinical information system. This clinical information system, as I said earlier, is just focused to provide, clinical care, to support nurses for providing the clinical care to patients and doing the clinical documentation. But when we say healthcare information systems, health information system, we mean a more broader term, which, for instance, support nurses to do scheduling, to improve the communication between different personnel and even patients and nurses through emails or electronic messaging. Also, by using healthcare information systems, nurses would be able to do cost analysis and finding trends, for budget controlling purposes, and also doing evaluations and quality assurance to make sure that actually the system has reached to outcomes and improved patient outcomes. A third application would be support nurses with their education. So actually it's a wide area of a specialty today available through different types of technologies and distance learning and e-learning, and even interactive video technology, computerized assisted instruction. So much of the education today, whether it's formal or informal, is happening through web-based platforms. So as an example, we can refer to MOOCs, or massive online open courses, which provides access to almost every topics, also in the healthcare and also in the nursing practice. It could be more advanced topics or it could be less advanced topics. Also today, many different continuing education programs are going to be provided using online platforms and through distance learning, and support nurses while they're working through providing short courses or even degree-based courses. Just a real example is happening right now at present time, which we are delivering this short course through actually online platforms. So when we discuss about distance learning and e-learning, we can assume that different types of environments are also discussable. This learning could be provided only on campus areas, for instance, or could be blended learning. So part of the education is going to be provided on the campus, and another part of the education is possible to be provided by distance learning tools. And even it could be totally virtual through virtual management systems or learning management systems. So these are some kind of topics that when we talk about distance learning and e-learning, informatics tools could help us to provide that support for education in nursing. A fourth application would be how informatics tools and methods support nurses to do the research. It could be, an instance could be adoption of, let's say, standardized language systems related to nursing, such as the NANDA, helping nurses to use a preferred language system, which is standardized and accurately implemented. So using that standardized language system, for instance, in a computerized literature searching would make us able to, search accurately to find the best and the most recent evidence. And as just I'm saying, another example would be computerized literature searching, such as CINAHL, Medline, and PubMed, which probably you have used a lot, and other web sources. And if you also refer to those electronic health records, those large data sets, aggregated data sets, which is available, could be used for doing research, as also discussed a little bit earlier. Here you can see 5 stages that how nursing informatics is linking to the research process. So while a nurse is providing patient care on a medical ward, maybe a problem in patient care is identified, which for it there is no current process in place. So the next step would be to use that technology and use, searching databases and having information literacy and, computer literacy to use that databases to find the most research evidence-based practice, or maybe other research related to that particular problem in that patient, to find to support, the care which is going to be provided to the patient. So a nurse starts to actually collect those new information using technology, asking questions, and then formulate a hypothesis to do a research to consider how using this recent evidence actually can be applied to address that particular problem in a patient. So based on the evidence, a new process is going to be developed, which is going to address that specific patient problem. When that intervention actually has been completed, then the evaluation process is also takes place, which leads to new developments and maybe new clinical practice guidelines. A final step in this research would be develop a procedure which is going to be used by also other healthcare providers, other colleagues, to address the problem from now on. So for nurses, it's required to be actually equipped with some skills and competencies while they want to do research. For instance, as I discussed, they have to be equipped with information literacy, and they also need to be equipped with how to do a systematic search in evidence-based databases. So it's how informatics is affecting research that nurses are actually doing. So here you can see an example of a snapshot actually of the database CINAHL, which provides access to the recent evidence-based research. It could be qualitative research, quantitative research, systematic reviews, clinical trials, etc. So it's particularly has been designed to support nursing profession. We also have other databases such as the PubMed Medline, which provides access to a wider range of topics in biomedicine, and even Scopus, which is affiliated to Elsevier. Again, it provides access to publications in the field of biomedicine. So these were just some examples of how informatics is going to support nurses to provide to do research. Okay, now we're going to discuss about some roles that nursing informatics specialist is kind of responsible to perform. And from all of those definitions provided for nursing informatics, as well as considering those application areas for nursing informatics, we kind of can assume what types of actually functions are expected from nursing informatics specialists. So here we have a new term as nursing informatics specialists, or the NIS, which is defined as a nurse who has formal education or certification or practical experience in using computers and inpatient care facilities. Different roles and functions have been attributed to a nurse informatics specialist, such as titles would vary from a project manager or clinical project manager, a clinical analyst, nursing informatics manager, clinical IT directors, chief information officers, chief nurse officers. So these are kind of titles that you can see in our literature when referring to functions of a nursing informatics specialist. The Healthcare Information and Management System Society, or the HIMSS, has surveyed actually some informatics nurse to see and to ask about their most common job duties in the healthcare systems that they're working. And it's interesting to note that according to that 2020 survey, and 44% responses of those nurses, system implementation is actually the most common job duty at the moment for a nurse informatics specialist. So it's the results of 3 rounds of that survey. The red bar are the results of 2020, and the light blue are the results of 2017, and the dark blue is the results for the 2014. And you can see how these job titles actually been kind of changed, but they have a steady flow, as you can see. So the most referred job titles for a nurse informatics specialist would be nurse informatics specialists, as 24% of the respondents have actually respond. And then we have the clinical analyst, which was responded by 30% of the participants. And then director of clinical informatics, followed by manager of clinical informatics. Let's also discuss about the functions which the American Nursing Association has provided for a nurse informatics specialist. So functions vary from theory development, where a nurse informatics specialist contributes to the scientific knowledge of the field by acting as a theorist to just, add to the body of knowledge in the field of nursing informatics. At the next level, and when we think about the implementation of an information system in a healthcare setting, the function would be analysis of information needs of the stakeholders of that information systems to see what information needs are required by nurses, by physicians, or even if they're going to see a role for instance, patients, what kind of needs do you have? To support, the clinical care, the education, the research, and also the administration. Then the next function would also be selection of a computer system. So if the system is not going to be programmed from the scratch, and if the organization wants to buy that information system or that computer system, nurses could have a role to guide their users, to make informed decisions about purchasing a good computer systems based on that analysis of information needs. Then the next function would be customization and designing of that computer system. So the NIS collaborates with different stakeholders, such as the users of that information system, as well as the computer programmers, to make sure and to make that every single decision they're making is supporting the information needs of those stakeholders. And when the system, whether it's actually programmed from the first or is just has been purchased, would be implementation and testing of that information system to see if it works well and it fulfills the different information needs of its users, and actually it can be ready and it's available to be used in a clinical care setting. Also, the NIS would have a role in training users on how to use the system. provides guidance on how important it is, to do the clinical documentation accurately, and how system in turn will benefit them with all those automation, and ultimately how it's going to work to improve the patient outcomes. And a final function would be the evaluation of the effectiveness of that computer system to see if actually meets those goals which was set at the beginning, and to see if the system is actually is working, effectively. So 2 more functions, and that would be ongoing maintenance and enhancement. So NIS has a role to make sure that if there is a new feature which has to be added to the information system, then it's happening. So they could have a role in that, in identification of further enhancements, which makes the system a better system to serve the users and also the patients. And here's the last function, and that would be identification of new advancement in the field of computer technologies, whether it's a new software or it's a new hardware. So if the system needs to have that particular computer technology, then it could be the role of a nursing informatics specialist to have the knowledge and to be up to date in the field to make some recommendations regarding, for instance, purchasing a new hardware. So if you think about it, you can see that all of these functions are kind of functions which has actually which is discussed in system development lifecycle, starting with planning, analysis, design, implementation, and maintenance. And we can see that the nurse informatics specialists have major functions in each of these different phases. Here, I want to make a point and say that, well, it's not something that we can actually prescribe for every single healthcare facility in every country, because the level of actually the functions which are going to be performed by a nurse informatics specialist is dependent to a couple of factors, including the level of advancement of the field in a particular country or in a particular setting, healthcare setting, also the cultural organization of that setting. Also, another factor would be the level of adoption of information system, whether clinical or health information system in that particular healthcare setting. So it's kind of dependent to many factors, and we should see which healthcare setting we're talking about. So if it's a low resource setting with limited, let's say, digital literacy of healthcare personnel, then some majors would be, changed, and it's something that we should be careful with that. Okay. As the final discussion point, I want to say that having said all this information, from the importance of nursing informatics and the importance of equipping nurses with informatics, competencies, we shouldn't forget that there are still some barriers to use all these technologies in a healthcare setting. So research suggests that, for instance, if an electronic health record is implemented in a system, well, the healthcare personnel as well as the nursing may face some challenges to use or to adopt that electronic health system. For instance, a research in India suggests that nurses had really problem with training on how to use that electronic health record. Or another research in some hospitals in Germany suggests that nurses had technical issues as well as organizational issues regarding using, an electronic health record. For instance, technical issues was like bad performance of a system or software not working, an organizational system where such as lack of enough time for nurses, to be involved in embracing those technology. And also another research in the US, a rural Midwestern hospital suggests that barriers for nurses were computer-related, nurse-related, and contextual-related. Computer-related were issues such as the interface or slow system. And nurse-related barriers were such as lack of experience on how to use that information system or poor time management, and also contextual barriers, which were lack of training or lack of support from technical staff. So I want to actually say this, that if we're going to encourage nurses to embrace technology and to use that technology and to keep up with the pace of advancements in technology in healthcare, we should think about some potential challenges that nurses have and might face, and to identify those challenges and then address them. Then we can make sure that we are just stepping in the right path to encourage nurses to actually embrace the technology. And it's not just limited to clinical practice. Even if we want to use informatics in research for nurses, that we want to actually advance the nurses' knowledge and skills in using, for instance, electronic literature searching to support the research. Again, there are a couple of challenges and barriers. For instance, the research suggests that time requirements, searching skills, access requirements, computer literacy, interface characteristics, quality of information, nurses' preferences, and organizational settings were among some major barriers for nurses to apply electronic evidence-based literature searching. So the hospital management, the healthcare system management at the organizational level, as well as at the national level, first should identify these potential challenges and then address them to be able to actually make sure that nurses have, the space to, use that technology. And I'm going to conclude the presentation with saying that today healthcare needs are just far beyond doing, clinical documentation and reducing the time which is needed to do that clinical documentation. And issues related to data and knowledge, such as the high intensity generation nature, the management and the processing of that data and knowledge, are integral components of nursing care. So informatics could give nurses some means, some tools to carry out these aspects to improve, the patient's outcomes. And then, having said that, the skills and knowledge of nurses make them valuable assets to any organization and also for the future development of the field. I'm going to finish up with a statement by Virginia Saba, which says, by the turn of the century, most healthcare delivery systems will function with computers and will be managed by computer literate nurses. So by the turn of the century, high tech and high touch will be just integral parts of any healthcare delivery systems. Here you can see some references that I used for preparing this presentation. And at the end of the presentation, we have some time, almost 10 minutes to 15 minutes to just discuss about some questions. Here I have provided you with 3 discussions, and I would like to start with discussion 1. But before we go to the discussion part of this session, we can also give you some time to raise your hand, so you have time to raise your question if you have any about the topics which was covered today, and then we can discuss about these questions that I'm having here. And before actually closing this section, we're also going to repeat that assessment that we did in the first part of the presentation. So I would appreciate if you stay till that so we can start that assessment. Okay. So before we start the discussions, you can just raise your hands by the raising your hands option of the Zoom to provide any questions that you have from these presentations. So if you have any questions, now it's time to just raise your question. Yes, please. Sure. Please unmute.
Yes, I'm Tim from United States, New Mexico. You did a great job. So the first question I have is, as healthcare tries to catch up with technology, I felt that this lecture did a great job pulling that together and addressing the use case. Where do you see that use case moving next? That's my question. Where do you see it moving next as it continues to evolve?
Well, I believe that the next action would be, well, I can speak about my country and the experience that we have. So it's not something which is applicable to every setting and let's say every country. But in Iran, where we are here at the moment, the next step would be to, we're still at the initial phase of recognizing the nursing informatics skills. Okay. So it means that here at the moment, we do not have a major, let's say, a formal education in the field of nursing informatics. So until we cannot recognize it as a specialty in nursing, I guess we cannot force the healthcare personnel, particularly the nurses, you know, to keep up with all those advancements and to perform all those functions which are expected from the nurses. For me, and in my case, I believe we should have some national policies in that, yes, which supports nurses in embracing technology and encourage them to be involved in, let's say, different phases of implementation of a technology in the clinical healthcare setting. And then it could be supported by formal education and also informal education in the field. And also, I discussed about some challenges. So these are challenges that we can see in our culture, in, you know, at the organizational level in our hospitals and healthcare settings. So the next step, I believe, would be addressing those actually barriers and challenges. Then we can be kind of hopeful to see, you know, more advancements in the field. Great. I also invite, thank you, and thank you for your question. I also invite Dr. Darvish and also Dr. Seilani. They could also provide us with their insight in each of these questions. Thank you.
Well, okay, I just want to say thank you, Timothy, for a very nice question, but I invite him to continue for the next sessions to find his answer, because this session is actually about the principles of nursing informatics.
Okay. All right.
And when you continue, you will find out some more about the application, sure, and how nurses can improve healthcare by this.
Very good.
If you have any more questions, we hear. If you have another question, we hear that. Thank you.
I also have some questions for discussions. If that's okay, Dr. Darvish, I'm going to share my slide again. Oh, sorry. It seems that Hamida is having a question. So Hamida, please go.
Thank you very much for this opportunity, especially for Dr. Seilani, which inform us as nursing college and the nursing academics in Kurdistan region of Iraq to participate in this new topic, we can say hot topic in the nursing profession. My question is that if we add the having skills in nursing informatics as another responsibility for nurses, do you think this will be also affected on the financial support for the nurses, or make more burden for them in the environmental work? And I think it increased the maybe the volume of the work that may they have in the environmental work, and also on government to support these nurses for paying or financial issues. Thank you.
Thank you, Hamida, for your interesting question. Actually, these questions are out of the topics covered by my lecture, but as these are interesting questions and no other relevant questions to the lecture are here, it's okay that we talk about these other issues. So I believe yes, the answer would be yes. At the same time, it imposes more job responsibilities for a nurse, and also she needs, or he needs, more skills and competencies to be able to, perform as an NIS. So at the same time, I believe they need to have increased, in their salaries and pensions, comparing with, for instance, another nurse without these, informatics skills and competencies. So how's it in your country? I'm going to shift it to my discussions. Can you provide us with some explanation how advanced nursing informatics is in your country? And for instance, has it been recognized as a major in the educational system and also at the healthcare, at the healthcare system, or not? And maybe in terms of the salary, you can also then discuss. I guess Hamid is muted.
Yes, thank you for this question. I think we need time to get this, to add this job for our nurses, and unfortunately, we have no well-developed informatics system in our hospitals and general in our health system. So, but this training will brainstorm us and encourage us to think about that, and at least we add to our curriculums in the nursing colleges in Kurdistan region and Iraq, and to starting and negotiation with our stakeholders in the Ministry of Health to starting that.
Thank you.
I'll be very brief.
Sure.
So I worked with the Texas Medical Center in Houston, Texas, and there the nurses actually drive this entire initiative. So you have people doing quality, data, and also doing the merge from the EHRs into reports. We specifically worked with the surgical teams to get patient population health outcomes, and then we're able to use this to support what we expected to happen with morbidity and mortality. So it became very strong. My role as clinical project manager was to coordinate this, and it became very robust. And I think that framework would really be helpful, and I'll be happy to share that with you offline.
Oh, that's great. And we would be happy actually to receive it.
Great.
Thank you.
Certainly.
So, okay, here I'm sharing my screen so we can see some discussions here. The discussion one is how much information technology is integrated into nursing curriculum in your country, Has nursing informatics been recognized as a specialty in nursing in your country, or does your country offer formal or informal education in nursing informatics? So I invite audience to actually provide their experience related to this question. How much information technology is integrated into nursing curriculum, and in the next level, has it been recognized as a specialty in nursing, or does your country provide formal or informal education? I would appreciate if participants share their experience regarding this question. So as I said, in Iran, we do not still have a formal education for nursing informatics, and by doing initiatives such as establishing this online short course, we're going some just first steps toward establishing the nursing informatics as a specialty and bringing it into the educational system. So how is it different in your country?
ناشكي بس فكرة كم؟
لا زلوك شنو؟
لا ناشكي أقول لك من هذه
سأل ليك مش كده.
Well, hi everyone. I'm nursing director in Iran, and in my opinion, the nursing informatics must be updated her curriculum and must import the new topics of nursing informatics to the curriculum of nursing in Iran for nurses and nursing managers. What's your solutions for this?
Sorry, I didn't.
If I think you couldn't hear that, can I answer?
Sure, please.
Okay. I think for every improvement, we should go step by step. So first of all, we should improve knowledge. What is the definition of nursing informatics? What are the applications and how it can improve the outcome of nursing care? So this program in 4 parts and in 4 weeks actually included all of these. In this session, just the principles of nursing informatics, and next session, you will see what are nursing informatics competencies. First of all, we should know what are the competencies, okay? Then we can go ahead and have our curriculum for the universities and find out the benefits and work more on it. And this third session will actually focus on the classifications of, for example, NIC nursing intervention classification or nursing outcome classification, and NANDA and the other systems for nurses. And then in the last session about future of nursing informatics. So I think it's very nice we have you as some people who are interested in this subject, and we invite you to continue to the end of this program, and then each of you with more knowledge and information can do something to improve nurses by IT tools and improve their work outcome. Actually, that's our objective, to improve health. Thank you so much. Just that I want to say.
Thank you, Dr. Darvish. So any other comments or questions? Would be happy to hear from you. Yes, please.
All right,
Solomon,
thank you
William?
yeah. Thank you very much for the opportunity for this. We are very grateful. So I want to talk about your question. So I'll talk about it in two perspectives. I used to work in Nigeria before, in Africa, and currently I'm speaking from the UK. In Nigeria, nursing informatics is not yet been implemented. In the government hospitals, it's still a paper-based kind of system. The electronic system is not yet implemented, but in big private hospitals, they use the electronic system. Also, in the educational system, about 2 or 3 universities does nursing informatics as a major, but it's still like in the infantry stage. It's still at the lower stage. So it's something that they are trying to bring up and improve knowledge about it. But in the UK, it's been implemented in most hospitals in the UK, and then in the university, it's being used. It's being taught in the universities as a credit certificate course, 20 credit certificate course, or at the master's level. Also, there are apprenticeship in the hospitals by different NHS trusts that can like try to bring more exposure to nursing informatics and so on. So it's kind of two different systems in there. So if I'm going to randomize it, I'm going to say Nigeria is kind of somehow like at the stage where maybe Iran or Iraq is currently in also. Yeah, thank you very much.
Thank you, William. Thank you very much for sharing your experience. I believe, at least in our region, there is no formal, as far as I'm concerned, no formal education in this field. Let's hear from Dr. I'm not saying your name. Oh, yes, Dr. Karim, please.
Hello. Hello. Thank you so much. I appreciated your scientific effort. And I hope all College of Nursing all over the world included the nursing informatics, because nursing informatics is very important. Today, you know, everything is changed because of medical technology. For example, in medical field, a robotic system for removing stone in the kidney and so on. So my suggestion is included the nursing informatics in all colleges of nursing all over the world, especially in Iraq, in Iran, and another country, and based on the conference in order to change the curriculum. You know, curriculum is very important to be included students scientific information about nursing informatics, in order after graduation, they will be ready to work in the hospital or even in the university as academic human resources. Thank you so much.
Thank you, Dr. Karim. Do you think, what do you think is the most important challenge for the educational system, you know, to establish the formal education for nursing informatics for countries such as Iran and Iraq, or even the Middle East?
Yeah. So my suggestion is the conference should be meeting the conference or organizing the conference in each country in order to include the nursing informatics in the curriculum of the College of Nursing. That's my suggestion. It's very important. Thank you.
Yes, actually scientific collaboration are quite important to, you know, actually for further improvement in this field and to absorb the Actually, I want to say, to pay the attention of everybody, every stakeholders into the field, and to do some collaboration in this field. Okay, is there any questions, or is there any other experiences that you want to share with us in terms of the nursing informatics education or implementation in the healthcare setting?
Excuse me, some of the participants typed their experiences in the chat box, and they are very nice experiences. For example, Claudia Tiva has written, in Ghana, we have a master program in health informatics. Nursing informatics as a specialty area is gradually evolving. And also Ahmed has written that in his PhD program worked on this course, and it was very interesting, IT skills, and he wrote that I want to continue to connect with my nursing professional. And some other points, I think audiences can study them. And also, I think more discussion we can postpone to next session if you agree. And
Sure,
ask
actually
them,
we're running out of the time, yeah.
ask them please to write in chat box or send email. Thank you so much. It was very nice, and thank you hearing all the participants. Thank you so much.
Okay, thank you everybody for all the precious participation that you had during this 2 hours. I would really appreciate the participation of every single one of you. We hope to see you also next week at Saturday, the same date. And we would be honored to have the lecture of Professor Hepta on nursing informatics skills, which would be a quite interesting speech. I myself I'm so excited and look forward to that speech. So thank you all.
And we have
That be...
Doctor, we have poll post test.
Oh yes, I almost forgot that test. So before you just leave this session, I would appreciate, to once more fill out the questions. Here you can see on your screen. These are the same 5 questions that you saw earlier at the beginning of the presentation. We would appreciate if you take some time before your leave to just answer the questions. Thank you very much. Also, the recordings as well as the slide would be available on the webpage of the course. And in the chat box feature of the Zoom, we actually provided you with this information. So you can visit the website. Yeah, thank you, Maliha. You can see here the link to our webpage, which the slides as well as the recordings will be available soon. Thank you for all the participation. The contact details of every lecturers would be available on the webpage, which was provided to you. So if you had any questions regarding these topics or other topics in the nursing informatics, you could send us email and we can share data. So I would appreciate if you could close the poll. And yes, thank you. So clap for yourself for your valuable participation. Thank you so much. And we're going to see you next week.
Thank
So
you
Dr.
so
Darvish.
much. Yes, thank you so much. It was a very nice presentation, and we really learned so much. And I want to thank to the program director and the dean of the university, and also the technical team behind this program, and for all the supports and helps. And also the participants who interested, and they shared their vision, very nice vision. And I hope you enjoyed today a great lecture of Dr. Azadi. And I actually recommend you to study some books and articles of Professor Hebda for the next session. And we will see you on 27 February. And we will have Professor Hebda lecture from US, who is the pioneer in this field. Thank you so much. And for Iran, good night. And for other countries, again, good morning, good evening. Thank you and goodbye.